Hello dear patients. Today we are going to review the case of removal of big wart on the foot. A young man came to see us. He had pains during walking. For quite a long time he had a neoplasm on the foot. You can see it on the picture. Here it is important to differentiate between A. the wart itself and B. a blister. These are two principally different things. Wart is a viral disease and blister is a disorder of epidermis keratinization. If in the first case, that is removal using different methods, also during relapses, that is antiviral therapy, in the second case it is not only removal but treatment of disorders in the foot itself. The patient has to visit traumatologist and orthopedist, etc. Here it is important to do dermatoscopy to see if there are red spots, if there are seedings of such neoplasm. It is quite big in size, and during dermatoscopy it is clear that it is a wart. What needs to be done during such big warts? My opinion is that quite often such big warts are removed by laser, also they are removed by radiowave method. However, these methods are dangerous in that there may be quite a big scar, particularly if the wart is very big, 2 to 3 centimeters, etc. What do I do in particular? Usually, for the beginning I remove by liquid nitrogen to decrease the size of wart. Sometimes it disappears even if it has such size. However, this doesn't happen quite often. In most cases we do burning by liquid nitrogen as is shown on the picture. It gets white and burn gets developed, by which the skin removes itself together with wart, and considering the absence of scar or a very minimal scar after liquid nitrogen, we can further remove either by laser or by radiowave method the part of wart that was left after removal by liquid nitrogen. I quite often use this to decrease the size of scar if it appears, because sometimes the scar bothers more than the wart itself after such removal. How to treat such wart? First of all, if quite a big scar developed, then it has to be pierced, and it is advisable to consult the doctor who did removal, so that it would be done in aseptic conditions, and then to treat it first with disinfectant medications, then to treat the burn by pentanol or levomecolum, etc. This is what is done during burns. How often the examination and removal need to be done during normal healing? Usually such wart not only heals but renews, and we see the final result in about 1.5 to 2 months. Sometimes it takes more time. Usually I do not do the removal of remnants earlier than that time. Then when we see what is left after our burning by liquid nitrogen, we do additional removal by other methods, or less commonly we use the same liquid nitrogen if the patient expresses a desire to do removal by this method. If it is necessary to remove different warts in different localizations, particularly on the foot, you can consult dermatologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do removal, diagnostics, treatment of different skin diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.